salutations. This is the second episode of Sim-portant Conversations at SD State. I am your Master of Sim-eronies, Patrick Verley, instructor at the Sioux Falls location here within SDSU College of Nursing. As you recall from episode 1, we had unpacked the first 5 of the 10 standards that were published within the Clinical Simulation in Nursing in September of 2021 by the International Nursing Association for Clinical Simulation and Learning Standards Committee. In this second episode, we will be addressing the second set of 5 standards, standards 6 through 10. Once again, I am joined by a number of panelists on our session today, and I will give them an opportunity to introduce themselves at this time.
Hi, everyone. I'm Dr. Alyssa Zweifel. I'm an assistant professor at the Sioux Falls site, and I serve as the director of our Healthcare Simulation Center here at SD State.
Good morning. My name is Allyson Stromer. I'm a nursing instructor with SDSU College of Nursing in Rapid City. I serve as faculty for simulation, a simulationist in Rapid City.
Hello. I am Takara Schomberg. I'm one of the nursing instructors here in the Sioux Falls site and serve as our simulation site coordinator as well as a simulation instructor.
All right. Well, thank you all for that Simmerific introduction. We will now be looking at standards 6 through 10, as I mentioned. And the first standard that we're going to be talking about in this installment is operations. And Allyson, I understand that there's quite a lot to discuss with regard to this particular standard.
Thanks, Patrick. Yeah, with operations, we're really looking at a lot of the behind the scenes effort to create a simulation and run that simulation so that we can support our students to successfully meet learning outcomes. It includes things like that simulation infrastructure, the processes that includes team and policy development. It outlines job requirements and role delineation for operational roles, leadership roles, and simulationist roles. And it also includes things like budgeting, and all of that has to come together really as a part of the larger curriculum, the college curriculum, and has to be also a cohesive part of the strategic plan. A big part of operations is including all of our interprofessional partners that work with us, and it's a variety of stakeholders from within the college itself, within the College of Nursing itself, within the university itself. We'll talk a little bit more about interprofessional operations within this podcast today. And really the overall goal behind operations is to create a sustainable and effective simulation-based experience, or SBE program. So some of the things just specific to criteria that I wanted to highlight when we talk about operations today include things like personnel having appropriate training. So we use specific modules, as we've mentioned in the previous podcast. I'll refer people to that if they're curious about that. And then certainly another part of that criteria is to also have ongoing educational opportunities to sustain the program. So it's not just that initial foot in the door, that initial understanding of simulation, it's really that ongoing criteria. Again, it has to include job descriptions, talking about role scope and responsibilities, and that's for all people that have their hands on a simulation. If it's our techs that are very behind the scenes, or simulationists themselves, delineating some of those responsibilities is really important so that students can meet learning outcomes in an appropriate way. Our successful SBE program also talks to the idea of supporting staff in the pursuit of different certifications, attending conferences. And then something else that I want to point out about this criteria too is that with our geographic challenges that we have in the state of South Dakota, we've got 4 different sites for the College of Nursing within SDSU. And so there's a big part of that operations and to meet the criteria that says, we all have to be running the simulations the same way. We're running the same simulations, but we have a lot of autonomy site to site, given some of the logistical opportunities that we have. Other parts of operations includes things like space. That's where that different opportunities for 4 different sites comes to bear as well. Equipment, resource management, all of those things fit under operations, including time to set up a simulation, time to tear down a simulation, making sure that we're creating simulations with that information outlined in there. And then certainly making sure that we are always reviewing our SBE process to continually be improving that.
Wow. So, I mean, I can't imagine that there's a whole lot that you didn't address in that description, right? It sounds like it's really all encompassing of, as you mentioned, everything from setting up that simulation to ensuring consistency across different sites and different sessions. Yeah, I look forward to the episode in which we can dive even deeper into that in light of the very, as you mentioned, sounds like multi-layered characteristics of the operation standard. So with that, then we'll move to the outcomes objectives standard. Alyssa, would you mind taking care of that one?
Sure. Yep. So outcomes or objectives and outcomes are really that blueprint of our simulation design and activity. So just like any other educational activity, we want measurable objectives. And of course, we want the participants to know what the objectives and the outcomes are before they start the activity. We follow the SMART goals, similar to any other educational pieces. We want them to be measurable. We do have two main forms of evaluation that we do in simulation. It's formative and summative. And I'll briefly talk about the definition, but this comes from the Healthcare Simulation Dictionary that was published in 2016 by the Agency of Healthcare Research and Quality. So formative evaluation is when the facilitator focuses on participant or group progress towards a goal or an objective. And again, this standard makes you set those prior to and then have them very vocal for the participant. And then summative evaluation is at the end of a learning period to determine competency for that healthcare participant. Usually is related to a goal or a grade at the end of a course. So like I said, we use them both here at SDSU. Typically, we use the formative more in our undergrad curriculum, and then our graduate curriculum is where we use both formative and summative.
I see. So as you mentioned, not unlike any other teaching modality, making sure that we observe sort of that backwards design to simulation, right? And make sure that the learners are accomplishing the things that we want them to. And I think that represents a point of clarification for students a lot of the time, so that they don't fall victim to this delusion that simulation is not important or it's just a game, right? And really helping them and supporting them to understand how impactful this approach to learning nursing and allied health professions can be.
Correct. Yeah. And all of our objectives and outcomes are listed in all of the students' prep work. So they know it, at the beginning of the semester before the activity happens. And then we also read them and put them on a PowerPoint visual when they start pre-briefing of our simulation activities.
Yeah, I think it's really important. I think back to my time as a student, and I don't know that I'm sure that they had learning objectives, right, in my courses, but I don't remember ever talking about those or reading those. Certainly it wasn't something that I took seriously as a student. And so I think, like you said, having multiple points and multiple opportunities to address those with the students is really important.
And if I can add, Patrick, I know we talked about debriefing last time, but that's where we reinforce it as well. So we talk about objectives in their prep work. We talk about it in their pre-brief, like what are we here to accomplish today? But then part of our standardized approach to our debriefing has us revisit those before we leave and have the students reflect on how did we meet these, not only in terms of how well did we meet it, but in what ways, asking them to give us some examples of how it was demonstrated. And I think it really reinforces for them that we were here to accomplish a task, and that some of those tasks maybe like in terms of like the critical thinking type objectives, maybe we didn't fully see them met in the simulation scenario itself, but certainly in our debrief conversation where we unpacked our decision-making process, that we did accomplish those objectives over the course of our time together.
Yeah, and in the same way, adding to that understanding that debrief is also a really important evidence-based strategy. And again, I think as a student, sometimes you don't fully appreciate, the reasons why we're doing some of those things. In their minds, it's not a real patient, right? Or it's not an exam, it's not a high stakes exam. And so therefore this must not be important, right? And so how do we help students purge those attitudes and get them to see how impactful simulation and certainly debriefing that simulation is. So we'll move on then to standard 8, professional integrity. Allyson.
Thanks, Patrick. Professional integrity really speaks to a lot of the ethical behaviors and conduct that are expected throughout an SBE from all the participants, and that includes facilitators and the learners as well. It helps to support self-awareness of how our personal and professional values and behaviors impact others. And as we're sort of talking about outcomes and some of those things, sometimes the SBE process can be seen as a high stakes environment, with facilitators sort of seen as having all of the power in that learning experience. And so the idea behind a lot of professional integrity and a lot of the standards that we're talking about in our podcast are really to help to create a safe learning environment for the students, where they can have that active exchange of ideas. And that's a part of debrief with that good judgment model, is to help learners recognize what things am I doing well, where do I have opportunities for growth, and how can I take that into my professional practice. So again, with professional integrity, the standard really speaks to making sure that we have created this confidential, safe learning environment to support learning for the students. There are policies and procedures in place, of course, if something happens throughout the course of a simulation-based experience that maybe isn't meeting criteria or is unsafe or unethical in some way. And the standard really reiterates that we need to make sure students are aware of those policies before we have to have a conversation that occurs outside of simulation because of something that didn't go as expected. One of the criteria specifically talks, again, reiterating that safe learning environment by communicating clearly and respectfully. So that includes communication that occurs between facilitators and students, student to student, or to maintain professional boundaries, working to manage disruptive behavior, because again, simulation, sometimes it's seen as high stakes, but as we were just talking about, sometimes it's seen as, this is a game. This is not really serious. I'm not actually in the hospital setting with a real patient. So, there's room for sort of stepping outside of that boundary, and that's not true. Certainly we want to make sure that all are being treated with respect, and that we create that safe space to allow students to acknowledge diverse perspectives related to culture, values, roles, responsibilities, and the expertise of other health professions, and make sure that students recognize how those different factors impact client outcomes.
So it sounds like this standard really provides a platform for students to engage in self-reflection, reflective practice, as you mentioned, diversity and respecting inclusivity and such, really looking at what are the things that they're doing that are potentially inadvertently jeopardizing those things without really knowing about it, so that moving forward they can, think more about having inclusive language and respect for all their patients.
Absolutely, Patrick. And I think too, with simulation, or even just kind of the profession of nursing in general, sometimes it's very easy to get siloed in task-based activities, checking the box on, I check the IV pump, it's infusing this fluid at this rate, I'm going to give this medication, I'm doing these things. And when we think about some of the nursing values that we teach in our nursing program, beneficence, non-maleficence, social justice, really making sure that we're focusing on that professional piece helps to bring some of that more to the forefront for students rather than just the task-based. It really helps them to understand that nursing is an art. It's not just this job that I'm going to go and do and check these things off of my brain sheet for the day.
Yeah, I love that, because you're right. Oftentimes, if it's not a psychomotor skill, right, then the student perception is that it's not real nursing. This isn't what's portrayed on the medical TV shows, therefore it's not medical, it's not healthcare. But supporting them and understanding the very holistic approach of nursing and taking into account all those different dimensions of complex people, I think sounds like are very much aligned to the professional integrity standard. So then we'll move on to standard 9, that's simulation enhanced interprofessional education. Alyssa, would you address that one, please?
Sure. Yep. So simulation enhanced interprofessional education, that's a mouthful. We short call it Sim-IPE. So this is bringing different healthcare professions together to prepare students for what they'll see and experience out in the healthcare setting. We like to create opportunities with other disciplines to really focus on teamwork, collaboration, and communication are kind of the 3 important skills that this approach focuses on, along with including all of the theories and frameworks from interprofessional education, the team-based learning, Kolb's adult learning theory. So all of those are brought into the standard. But when we look specifically at simulation, we're, again, creating an opportunity that our students would see in the healthcare setting to learn from each other in different disciplines. So here at SDSU, we typically start planning these events 3 to 4 months in advance. As you know, when you get different disciplines, the biggest challenge is finding a date to do these types of simulations and finding space that hold enough room for the participants when we get into these larger groups. So we typically plan out 3 to 4 months where we just invite all of the different interprofessional teams that we have availability to. Each of our sites has a different availability depending on our location. But in the past, we've done some work with the College of Pharmacy and Allied Health Professions. So we have some pharmacy students, respiratory care students, along with our undergrad nursing students, and then our graduate nurse practitioner students. And then most recently, we've been including some med students outside of SDSU. So as we follow the standard, we meet as a team, we set mutual goals and objectives. That way, from the beginning, every discipline meets, talks about what our goals and objectives would be. We have the same mutual objective going into the scenario, and then we revise the scenario as needed, depending on which disciplines are involved. And then in addition to that, we still follow all of the standards, the simulation standards of best practice that we've already talked about. So even though this is its own standard, we still have to follow, the simulation design, the pre-briefing, debriefing, facilitation, professional integrity, all of the standards we talked about also have to be followed when we do these interprofessional simulation activities.
Great, thank you. I think about how one of the things, especially as a new nurse, so often nurses aren't very sensitive to the demands and the responsibilities of other disciplines. And I think that simulation enhanced interprofessional education really does a lot in the way of exposing nursing students to the integral roles that other team members are playing as well, and the unique contributions of all the team members. And I think that as we move into the future and continue to have more and more complex clinical cases, I think the role of IPE is just going to have an importance that continues to magnify. So we will go to the very last standard then, standard 10, which is evaluation of learning and performance. And Takara is going to explain that one for us.
Yes, thanks, Patrick. So, we've kind of followed a nice progression here and talked about how we've set our students up for success and supported them throughout their learning process. So it's only appropriate then to speak about our evaluation of their learning and performance. Any of us who've planned a learning experience are familiar with that. This standard actually is unchanged from the previous set of standards. So our program is doing quite well at meeting it, but I'm excited to tell you a little bit more about that. So evaluation of learning and performance requires us to have a specific plan for how we are going to evaluate the learner. We need to have the timing of their evaluation, the type of their evaluation, a tool as appropriate. We have to have training for our evaluators so that we're being as consistent as possible. And then we have to be providing feedback to our learners. Our method for learning evaluation here, it can be formative, summative, high stakes, as Alyssa had discussed earlier, but she discussed earlier how we have used both formative and summative. We have stayed away from the high stakes evaluation here, which for those who maybe are not familiar, that would be the implication that this learning experience has a significant impact on a student's ability to progress in the program, for example, the equivalent of like a final exam type of assessment. We have not used that here. The majority of our undergraduate nursing simulation experiences are formative evaluation, where we're providing them with feedback about how to grow in different areas, how to close gaps in their knowledge, skills, attitudes, and kind of reflect on how that's happened over the course of the simulation and the debrief process. As we discussed previously, we use the good judgment model here. So while faculty certainly give feedback to our learners, our goal is that they primarily are giving feedback to one another and identifying areas for growth and improvement or items that need further clarification. We do have tools with all of our simulations that the simulationist fills out and jots down observations and how different standards and objectives are met. That way, if our learners do not point it out for one another, we have the opportunity to kind of introducing that, I noticed this occurred, or I'm not sure if this happened, perhaps I missed it. And they'll kind of reflect on, oh, I think you're right. I don't think we ever did do that or whatever. When we think about the summative evaluation, our graduate program uses that more than us, though a simpler version of it and something that students would probably be familiar with would be the idea of using validations or checkoffs, that sort of thing. While it's not scenarios, we're still asking the students to come in and execute this task as if they were in the hospital setting. We require them to wear their uniforms and talk to the mannequin or whatever the case may be. And so that would be a summative example that we do currently utilize in our undergraduate program. I can't think of a high stakes in undergrad. Can you, Allyson?
In relationship to sim, when we talk about high stakes, certainly we have a handle on what that word means. I think sometimes for students, there is anxiety behind simulation.
That's fair.
And I think, for them, we use prep work and quizzes and things like that just to prepare them for the simulation. And I think that the students do sometimes have in their mind that feels very high stakes. But as far as an actual, you may not be able to progress in the program because of this, I can't think of one in undergrad.
It does remind me though, Allyson, of what you were saying earlier about the psychological safety we create.
Yeah.
And that's one of the things that we do often clarify for our students during their pre-brief time, that they come in and we say, remember, this is meant to be a learning experience. We don't expect it to go perfectly, but we do expect that you'll learn with a better understanding of the objectives that we have today. So I think you're right, Allyson. They do often have it in their mind that this is a high stakes or a summative evaluation, and we often are reorienting them to the purpose of our simulation.
Right. And that's a great point, Takara. And I think with our standard program, we have those 5 semesters. That baccalaureate program has the 5 semesters, and I've had students really just in the last year or so come into that first semester And simulation does in their mind create this very, oh my gosh, I need all this information. I need to have all this background in my brain before I go into simulation. And so it's really been a learning curve with those first semester students to reiterate, just as you say, we're going to help you to meet learning outcomes here. Think about your nursing process. And I don't know if that conversation has necessarily lessened anxiety in a significant way. But I think once they progress in the program and recognize, okay, simulation is just a part of the pedagogy. It's another way for me to learn. It's that very hands-on, skill-based, and still, trying to do some of that affective learning as well. But it's okay if I don't have everything in my toolkit today. So I think from the student perspective, it does feel very high stakes for them.
I thought of one other thing I wanted to add, Patrick, in thinking about how we're implementing this right now. I hope we have an episode down the road where we can talk more about evaluation, because it's something that we as simulationists discuss often about how we can improve our evaluation process. Are there better tools we could be using? Could we enhance our reliability, our validity? Could we create more cohesion in our evaluation across simulations, more akin to what we do in clinical? It's something we discuss a lot. And so I really hope that we can find an opportunity to have that discussion here on the podcast sometime.
Yeah, I think that would be great. As I think about, students perceiving a simulation experience as high stakes, as I think about and reflect on my own nursing school experience, I thought everything was high stakes. Everything seemed like it was the end of the world. Every single thing seemed like it was so daunting. And, as you pointed out, our students are stressed. They're anxious, right? It's competitive. And I think that those things have only grown in light of the pandemic and the stressors that everyone's facing at the time of this recording. One of the things that Takara mentioned that I really appreciate is that in simulation, oftentimes in that post-conference or that debrief, students are providing the feedback to one another. And I think that's a really important consideration in all teaching modalities, that as the, quote unquote guide on the side, I don't need to be the only person administering that feedback. And that's something that, and in some cases might be even more impactful if it's coming from a peer to another student versus the facilitator. And so I think that's a really important consideration as well. And I think that should be all 10 of our standards then. Was there anything else that anyone had wanted to add with relationship to any of those that were discussed today?
Patrick, I think the only thing I would add is, we just gave a brief summary of each standard, and then of course we'll dive in deeper with some of them at other episodes, because some of them are very big and we just hit the surface of them. But when we talked about the evaluation piece, like what do we do with those evaluations? And we have thousands and thousands of responses of data a year. So some of those, just keep in mind, we will dive deeper. And this was just the beginning intro of all of the standards.
Good. Yeah, more to come, right? Okay. Well, if that is, I think, all that we have to share today, then we can go ahead and put episode 2 in the books. Again, this has been the Sim-portant Conversation episode 2 at SD State. We are looking forward to another Simtastic session in episode 3. Thank you all for joining us, and I hope you guys have a great day. Take care.